Hello, everyone. Thank you for joining us today for our next interview in the Women in STEM speaker series. Each Wednesday through September 30th, we'll introduce you to some inspiring female role models who are doing incredible work in a variety of STEM fields. This series is supported by the Association of Science and Technology Centers and If Then through a gender equity grant, which supports projects aimed at increasing the representation of women and gender minorities in STEM. My name is V. Wegman, my pronouns are they, them, theirs, and I'm a staff educator here at the Carnegie Science Center. Today, I'm excited to talk to Angela Cupelli, a pediatric oncology and bone marrow transplant nurse here in Pittsburgh. Angela, thank you so much for joining us.
Thanks for having me. I'm excited.
We are too. I have a few questions prepared to get our conversation started, but folks watching live are encouraged to ask questions of their own. Leave your questions in the comments and we'll try to answer them later on. Are we ready?
Ready.
All right. So let's get started. Tell us a little bit about your background.
Okay, so as you mentioned, I am a pediatric oncology and bone marrow transplant nurse in Pittsburgh. I have been in that specific area for the past 5 years now, and I've been a nurse for almost 6. And nursing was not something that I knew that I wanted to do right out of high school. It took me a while to find that career path. Science and math had always made sense to me in school, growing up, grade school, all the way through high school. I always thought it was very interesting. I was amazed at physiology and chemistry, and I loved that equations and numbers always made sense. So when I graduated high school, I decided to study biochemistry. Was my first major that I declared at Notre Dame. And once I got into those classes, I realized that I was way more interested in my biology courses than I was in my chemistry courses. So I changed my major to biology to pursue something that was interesting to me more, something I was more passionate about. Some of my favorite courses there were anatomy, physiology. I had a public health course. I thought all of those were great. They held my attention, and I really enjoyed going to those classes. But I wasn't exactly sure what I wanted to do with my biology degree once I graduated. I just knew that I wanted to help others. So I took a year off, and I actually did a year of volunteer work outside of the country. I was working with young girls ages 5 through college age in a special, not exactly an orphanage, but it was a home for girls that needed educational opportunities that they would otherwise not have had access to. And I acted as a mentor for them. I helped teach them there, took care of them. And I came back from that experience really wanting to work with kids and wanting to make a difference in the world. But I also still wanted to use my science background. So I was trying to figure out how exactly to make that happen and explored several different career options. I had someone suggest to me that I look at nursing, which before had never even crossed my mind. And when I looked into that career path, I saw that it was opening all the doors that I wanted. So I decided to go back to school for nursing. And I did a 1-year intensive program where I earned my bachelor's in nursing. So then I knew I was going to be able to interact with people. I was going to be active. I wouldn't be sitting at a desk job, which just wasn't in my personality. I would still be able to use science. I was going to be able to help people. So I was very excited to enter the career world of nursing. After graduating from nursing school, initially took a job to get a lot of great broad experience in the adult world of nursing. So I was in more of a step down ICU cardiac type of unit there. And after several months at that experience, I transitioned to what is now my dream job, where I get to take care of kids, and I am in the role as an oncology bone marrow transplant nurse. And I've gone on to obtain 2 certifications in that role to advance my knowledge more, advance my professional career. and just love what I get to do every day on the job. So,
Awesome. Well, I'm so glad you found your place.
yeah.
It sounds like a really good place to be. All right. So what does a day in your career look like? What's a day on the job?
So a day at work for me can vary day to day. It kind of depends what role I am going into at work that day. So primarily I am a bedside nurse. I'm a professional staff nurse, which means I'm at the bedside taking care of patients directly. So that is what I do 3 days a week for 12-hour shifts. And most nursing shifts are generally either 8-hour or 12-hour shifts whenever you're working at an inpatient facility like what I do, as opposed to a clinic type of role where you're outpatient. So a day at the bedside is I come in, I get my patient assignment, and the number of patients I'm taking care of on any given day can vary depending on what is going on with that patient, how much attention they're going to need during the day, if they're getting any type of infusions or medications that are higher risk. Generally, you have a few less patients than if you could take on a few more. So I come in, I get my patient assignment, I look up my patients, I take a look at their lab values, I take a look at the medications that they're going to be getting that day. And then we go into bedside report. So that is when the offgoing nurse tells the oncoming nurse all about the patient's history, what the patient is in the hospital for, and any other pertinent information. And we do that in the room with the patient and family present so that they can hear everything that we're saying and interact and contribute if they desire. Then I get my day started. So we have to do continued assessments throughout the course of the day. The nurses are kind of the people that are seeing the patients throughout the course of the day. We're doing the vital signs. We're listening to their lungs and their heart and feeling their pulses and seeing if they're having pain issues or nausea and any other type of issues that they might be experiencing. So we start the day off with doing a complete assessment from head to toe so that we can get a really good baseline of how that patient is at the start of our shift. That way we're able to see if any changes occur during the day. We also get vital signs first thing in the morning, and we are always watching our patients' vital signs during the course of the day, comparing them to previous values so that we can try to catch if there are any changes that we need to be concerned about. And then during the course of the day, like I said, we do continued assessments. We're giving all their medications. We're doing interventions if anything comes up, if the patient isn't feeling well, or if there's any emergency circumstances. We have to do a lot of education with patients and families, especially in the area that I'm in with their diagnosis, if they're a new oncology diagnosis, or care that they're going to need to continue receiving after they leave the hospital, or if the parents have to give medications at home or take care of any implanted devices that the patient now has. We have to do all of that education with the patients and families. And then we're also there to act as a support and to have conversations with the patients and families. We, in our spare time, love playing with the kids and forming relationships with them and walking with them in the hallways or blowing bubbles and just different fun things throughout the course of the day. So when I'm there to be a bedside nurse, that's typically my role. But I have a couple other roles in the hospital. I'm one of the instructors for our chemotherapy and biotherapy course. So any new nurses to my specific unit where we administer chemotherapy, or any other nurses who are interested in learning how to administer chemotherapy and biotherapies, they have to go to this 2-day course that's offered several times a year. And I'm one of the instructors for that. So we are educating nurses on chemotherapy, biotherapy, the side effects of those drugs and medications, long-term effects that those patients might have, nursing interventions for any side effects those patients might be experiencing. We talk about the cell cycle and how those drugs that we're giving affect the cell cycle and why it's effective as treatment for their specific cancer diagnosis. So that's a lot of teaching and educating and really looking at the breakdown of the biology and physiology of what we're doing on a day-to-day basis. And then I am also a member of our Quality and Safety Council in the hospital, which is a hospital-wide council. We have nurses and representation from all different areas that come together once a month, and we're looking at patient and employee safety data. We're creating action plans to improve those numbers because we want to create the safest, highest quality environment for our patients, families, and employees. And so we're constantly looking at that data and trying to figure out how can we improve that data. So understanding what the data means is also very important to my role as a nurse. But in all of that, I think things that stand out to me about my job are the continued opportunities to learn. Like I mentioned, having to educate nurses on chemotherapy and biotherapy, you have to understand all the newest chemotherapy, biotherapy interventions that are out there. So constantly learning about the newest thing in medicine, and that's always really exciting. And then forming the relationships with patients and families is just so special. So that is just always one of the best parts of my day. Especially in an area of oncology and bone marrow transplant, when those patients are admitted for extended stays or they're receiving treatment that spans years, really getting to know the patient, their family, their likes, their dislikes, and just interacting with them and seeing those kids grow and become their own selves and develop their personalities. That's always really, really special. So.
Yeah, we mentioned before we went live here while we were chatting that typically when you let people know you're a pediatric oncologist and bone marrow transplant nurse, people go, oh, that must be really hard, or that must be really grim. That was at least my first reaction of, wow, that sounds, it could be really sad. But you mentioned there's actually a lot of joy in this. You want to talk a little bit more about that?
Sure. Yeah, there definitely is. I mean, like I mentioned to you before, like kids just really want to be kids. So such an important part of my role as a nurse is creating that friendly, welcoming environment for them and having playtime and making medical things fun for the kids, supporting them, watching their personalities develop. And kids are really inspiring. Kids are really strong. They're really resilient. And so there are a lot of days where I just draw so much inspiration from the patients that I take care of, the families that I take care of, because they are fighting something that seems so much bigger than themselves, but they are just, still going strong and giving it their best effort. And we have a lot of really happy moments. We have celebrations when kids finish up chemotherapy and it's their last chemo, and we are all so excited for them and put signs on their doors and all sign the posters and cards and whatnot. And whenever patients are discharged from their bone marrow transplant, we line the halls and ring bells and throw confetti because we're so excited for them that they finally get to go home after this extended hospital stay. So we still get to have fun and like have those playful moments, and just we get to have those happy moments too. There are definitely days that are sad and days that are hard, but there are a lot of really, really good days too. And there are definitely more good days, I think, than hard days, which is great.
Yeah, that's lovely to hear. All right. How did a STEM education prepare you for your career and ultimately for this role as a nurse?
I think my biology background definitely was a really strong foundation for me as a nurse. Understanding how the body works, how body systems are connected, how cells function, that's so important, especially in administering any type of medication really, but particularly the chemotherapies, the biotherapies, the hematopoietic stem cell transplants, which are our bone marrow transplants. Understanding why those types of interventions are going to work for that specific patient. Having the biology background helps with that understanding. I think science backgrounds teach you a lot about thinking critically, which is super, super important in my job where things are changing all the time. You know, a patient might seem well at the start of the day, but by the end of the day, they are maybe feeling extremely ill, and we have to do all these interventions and think critically about what's going on with that patient and how can we help them. For pediatrics specifically, there is a lot of math involved in pediatric nursing. All of the medications that we give are dosed based on the patient's weight. So anytime we're giving a medication, we have to figure out, based on their weight, is this the appropriate dose that that patient should be getting? Because, you know, the doctors place the order, the pharmacy checks the order, but the nurses are the last stop before the medication is actually given. So it's really important for us and for everyone before us to be double checking that math, because we would never want to inadvertently give a higher dose than a patient needs. So checking all that math is really important. We do a lot of rate calculation for medications that's based on the weight of the patient. So if they have an IV infusion, we have to calculate the rate that the infusion is going to infuse into the patient based on maybe their weight or other factors that could be at play. So we use math all the time, every single day. And then I think science also teaches you a lot about research and quality improvement. All those experiments that you do in grade school and high school and college, it's preparing you to research, to think about a theory or a hypothesis and what do you think is going to happen. And nursing is driven by evidence-based practice and quality improvement. We always want to get better. So having that background in science of understanding how to conduct research or how to conduct experiments, how to think broadly and open your mind and think outside the box, and how to think about improving something, it's really important in the role that I play. And I think that is all taught with a STEM education.
Awesome. So you mentioned earlier you went abroad, and that's how you got interested in working with kids more specifically. Do you remember a time or moment that sparked your passion for science?
So I think I can't remember like one specific moment, but I know that in grade school, I think it was 5th or 6th grade was when for biology and chemistry, we started to be able to do labs. And we had like one lab day a week maybe. And I always loved that. Like I thought that experiments were so cool, and just digging down and like being hands-on outside of the book and actually getting to see how what I'm reading about works. That was always very interesting to me. So I think the hands-on experience definitely sparked a passion for wanting to understand more and wanting to continue to get hands-on with different things. And I think too, I mentioned, you know, my anatomy courses and my public health course that I took in college. Those were also very lab heavy courses. They were very hands-on. And I think that's why they were some of my favorite courses, is because it gives that hands-on experience. So definitely any type of like lab experimentation, I always loved. I always thought it was so interesting and so cool. So I think that was part of the spark, but there wasn't one specific moment, but just kind of all of that together.
Awesome. Is there someone who inspired or mentored you that you want to give a shout out to?
I think my coworkers, just in general, it's really important in nursing to be able to work together as a team. And that's something that my unit does really, really well together. And I think from our unit director, clinician, clinical leaders, so that's kind of like a step down of the hierarchy to then the bedside nurses. There is just an atmosphere of teamwork on my unit, and that is always really inspiring. I think it's very important to have those good relationships with the coworkers, especially in the field of nursing, when you're going to need to rely on help from your peers every once in a while. It's not something that you can just go to work and independently do all of your tasks for the day. You need a lot of help. So seeing how my coworkers handle different situations, seeing how different we all are and how we come together and what we all bring to the table is really inspiring. And you know, how one person is able to form a relationship with one patient and family, and then someone else is able to relate in a totally different way to another patient and family. I think it's just a really inspiring place to be. So definitely my coworkers are all a big inspiration to me. And like I said, we all work together to kind of mentor each other and just create the best team that we're able to. And then my patients inspire me every day too, like I mentioned. So
Well, Pittsburgh's very lucky to have a team like you guys.
yeah.
What advice would you give to someone who is underrepresented in a STEM field and interested in pursuing a similar career or area of study?
So anyone who's interested in healthcare, if you know that you're interested in healthcare when you're young, I would say get experience as much as you can with volunteering. I know that's going to be the first step for probably a lot of high school age students, because there's not too much more you can do in terms of patient care at that age. But you can volunteer in hospitals or other like healthcare related fields and get experience interacting with people who maybe aren't feeling the best all the time, because that can be its own challenge. It's one thing to kind of interact with someone who's healthy outside of the hospital, but it's slightly different to interact with people who are unable to get out of their hospital bed. So getting that volunteer experience, I think, is really, really important, because it is going to teach you so much just about the hospital environment. Any type of activity where you can understand how the body works, I would definitely take advantage of that if you're interested in any type of healthcare profession, whether it's nursing, physical therapy, occupational therapy, becoming a physician, speech therapy. There are so many different areas of healthcare that you can go into. But you always need to have that basic understanding of how the body works, and how to interact with people and what a hospital environment is like. So any type of experience that would expose you to that, I think, is really important. And then if you don't know necessarily when you're in high school or even when you're first starting out in college what you want to do as a career, like knowing that that is okay, I think is also very important. So for me, like I said, I did not know that I wanted to be a nurse when I was 18 years old. I had no idea. But I knew what area of study I was passionate about. I knew what was interesting to me. So I think immerse yourself in that, find what interests you, find what you're passionate about, in terms of something that you can actually study and read about and learn about, because you don't want to do something that you dread doing. So as long as you're studying something you're excited about, I think eventually a career path will open for you. So just knowing that, I think, is also very important.
How important is representation in science?
I think any type of diverse representation is extremely important. Diversity is key, because like I mentioned when I was talking about my coworkers being an inspiration, we all have different viewpoints. We all come from different backgrounds, which means we're all going to have different ideas. And in science, you have to question things and you have to be willing to learn and grow, listen to other people, collaborate with other people. And we're only going to be able to learn and grow and develop the best we can with all those different viewpoints and all that different representation. So I think having diversity is really, really important. Being open to all those different viewpoints is really important. So yeah, that's definitely key for science, because we wouldn't get anywhere if we were just all the same and all just sticking to our own viewpoints. There has to be that collaboration and that learning from each other and that growth.
Yeah, agreed. All right, so we have a couple of questions from Facebook from
Okay.
our viewers here. Is there a memorable moment that you experienced at work that you hold on to during those tough days?
I think for me, the moments where we get to celebrate like end of treatment for a patient, there have been many of those over the past 5 years, but holding on to those is definitely key, because whenever we're all lining the halls or we're all lined up and we're ringing bells and throwing confetti, and like you can just see the big smiles on the kids' faces, like they know they finally get to go home and like not have to be in the hospital anymore. And you can see the gratitude that the parents or the families have. I think that definitely makes the hard days a little more bearable, because you have all those memories where you have seen the difference that you're making, and you've seen kids get to go home. And so yeah, that helps.
Yeah. On a related note, how important is empathy when interacting with and relating to your patients, not parents, patients?
The parents too.
Yeah.
It's really important to be there for the parents also.
Yeah.
But empathy is definitely extremely important in our job, and that can definitely, it can be a challenge. You have to leave all your own emotions, and you have to leave what's going on in your own life kind of at home whenever you come into work, in order to be able to fully be present for your patients and families that you're taking care of. And you know, that was one of the reasons I wanted to become a nurse, was I wanted to be there to be a support, and I wanted to be there to form those relationships and communicate and talk with the patients and families and really get to know them and know what they're feeling and be able to support them through that. So empathy is crucial, and it can be a challenge to then leave all those emotions that you've experienced during the course of the day at work and then come home and be present to the family at home. So learning that transition between emotions, I mean, it's still something I'm learning. I don't think anyone necessarily has the perfect answer for how to do that, but empathy for everyone that we meet in the hospital is crucial.
Yeah, well, that's all the questions we have for now. Do you have any final words of wisdom or advice for the people?
I think just do what you are passionate about. Do something that makes you happy. And if, that means that you're the only, person like you in the room, like that's okay. And as long as it's something that you're passionate about, as long as you're pursuing a dream that you have that inspires you and that you feel really good doing, I think that is just so important. So yeah.
Awesome. Well, Angela, thank you so much again for joining us today. A huge thanks to our interpreter, Cheyenne, for signing along with us today. And we hope everyone watching will join us next week for a conversation with Mercy Shatemi, a senior systems analyst at Zimmer Biomet. We'll talk to her next Wednesday, September 23rd at 11 a.m. right here on Facebook Live. Also, we would love to hear feedback from anybody watching today. We have a brief survey linked in the video description and the comments so that you can let us know what you think of our Women in STEM speaker series. And as always, more details about the series can be found on our website, carnegiesciencecenter.org. Thank you so much for watching and have a lovely day.
Thank you.